This is All India Radio. In the special program on the milestones of 2 billion doses of COVID-19 vaccinations, now we bring you an exclusive interview with Dr. V.K. Paul, Chairman of National Task Force on COVID-19 Management. Interviewer is Anita Anand, AIR Correspondent.
India has crossed administration of more than 200 crore vaccine doses, which is a big achievement for a country like ours. Talking about this incredible journey of the vaccination drive in our country, we have with us Dr. V.K. Paul, Member Niti Aayog and Chairman of the National COVID-19 Task Force. Hello and welcome, Doctor, to our program.
Thank you very much.
So, Dr. Paul, how do you view this exemplary achievement in our vaccination journey?
Well, India has been undertaking the world's most comprehensive vaccination mission against COVID-19. And because we have a large population, we have to cover everybody effectively, and 200 crore for any nation is a momentous milestone. And it is a journey which has been undertaken by the people of India to fight against this virus which is still lurking around. But we are very proud that 2 billion doses having been administered, the nation feels quite safe in facing the pandemic. We still have the unfinished agenda of ensuring the precaution dose and of course some more coverage for children. But 2 billion doses, the world is looking up and noticing this, that our nation has ensured. But please remember that we are the vaccine hub of the world for childhood vaccine. And in some sense, having achieved this feat of 200 crore doses with made in India vaccines makes this achievement even more stellar.
So in a country like India, what are the challenges that you faced while achieving this feat? Like you said, it is a big target that we've achieved. So what kind of challenges?
Many challenges. A journey which started through uncharted terrain and waters. We didn't know anything about the virus in the early part. We knew very little as the pandemic management measures were getting unfolded in January, February, March and so on. But it is precisely at that time in the early course that a clear direction was given by the Honorable Prime Minister that sharpen, accelerate your work for a solution of the kind of a vaccine or multiple vaccines. We were also struggling for having indigenous diagnostic tests. But then vaccine was a special mission to be followed. So the Honorable Prime Minister directed to be created Vaccine Task Force. The Cabinet gave a very significant budget under the Mission COVID Suraksha for the Department of Biotechnology and created an environment where India was to move in the direction of creating, developing, manufacturing vaccines. And thanks to the leadership of the Prime Minister, the nation rose to the occasion. So we have the 200 crore vaccines, as I said, are made in India vaccines. One vaccine, the Covaxin, as we know from end to end, is essentially an Indian production. And we're very proud of this achievement. And the Covishield vaccine has been manufactured in large volumes. And in the pipeline are other vaccines which also played, some vaccines which played a role, but they are also there in the pipeline. So the country's scientific endeavor and the industrial endeavor rose to the occasion. And this effort, as I said, started very early in the course of the pandemic in those difficult days. To create vaccine in less than a year, to license vaccines in less than a year was a great feat. And then the issue is, yes, we could see the stockpiles building up gradually and then in a very quick manner coming up. And alongside this, the vaccine rollout started to happen. The second part is to take vaccine to people, to convert vaccines into vaccination. And that's implementation challenge. And in the implementation challenge, we have a couple of things. One, that we use the IT technology. And we were fortunate that challenge could be met very quickly because we have IT prowess, IT platform, CoWIN could be created. We also had at the back end another system which got merged or amalgamated into this system was the supply chain management system for vaccine movement from the manufacturing site to the site where it has to be delivered. Then there was a very scientific approach how to start vaccinating various groups because in the beginning the vaccination supply and production was limited. So prioritization was done on a very scientific basis. Again, something that has been appreciated by the world. Healthcare workers, frontline workers, then those with certain age and comorbidity. So the scientific process drove it, and this was appreciated. But then above all, once the vaccine reaches let's say the district point, it is the sheer capability and the resolve of our doctors, our nurses, our frontline workers, ASHAs, ANMs, and they became the front of this wave of vaccination delivery in every nook and corner. And you've seen wonderful pictures of our health workers walking in narrow bridges, which are bamboo bridges, or in the backdrop of glaciers, they are walking, they are going by boat. I salute, the nation salutes all these great teams that made it possible. So the challenges were create vaccines, create systems to deliver the vaccines, and then deliver the vaccine on the ground. And here, systematically, these challenges were met, building on the robustness of our health system that existed, particularly in the space of immunization.
So from ground zero to turning it into a major success story, the journey definitely has been amazing. But we all know that initially there was vaccination hesitancy, right? How did you actually meet that challenge of convincing people that this is for their own good?
Well, there were always skeptics from the beginning. Many things were stated. There were people who predicted that India will take 15 years to vaccinate its population. I believe such reports were there. But coming back to one particular issue that you raised, the vaccine hesitancy. Well, again, remember, this is a disease about which we knew very little in the beginning. Vaccines were created over a very short period of time, of less than a year. Normally, vaccines go through a journey of 5 to 8 to 10 and more years, and even longer. So when things happen at this pace, then people would like to be sure that we have the quality, we have the safety, and so on. So that is one aspect. Also, the general feeling as to the need for vaccine in some quarters, because there will be stories even on that regard. So there were multiple reasons why an individual would be hesitant. But above all, the individual could be hesitant in his or her own home because that information has not reached fully, that you have to come for a vaccine. Adults have never been given a vaccine. But put everything together, the issue is that once the entire adult population and almost entire up to 12 population has been vaccinated today, there is no hesitancy. And the hesitancy disappeared quickly. It disappeared because the health workers and doctors were the first ones to embrace, and it showed it must be safe. This happened in a natural way. And then also, as data started to come in about safety, no particular reaction, you go home, normal life. So people realized that the vaccines are saving lives. It became evident that those who were vaccinated were practically not dying. So communicating these facts about safety, the research data, the trial data, the early experience, owning it up by the people who embraced in the early phase, and then answering the skeptics about the safety, about the efficacy, and the fact that it was making a difference eventually led to the disappearance of vaccine hesitancy. And it happened very quickly. And on one particular day, more than 2 crore doses were also administered. So Indian citizens, we all ensured that once a public good has been presented in a trustworthy way, sharing data, speaking the truth, exemplifying it, people accepted it.
So very interestingly, from being hesitant to take the vaccine, vaccination drive has actually become a people's movement. Were there any strategies that were put in place to achieve this?
To make it into a Jan Andolan or people's movement, the credit should go to the Honorable Prime Minister, because he lent his own presence to this, his own ideas to it. And he communicated with the people directly. He communicated with the chief ministers to make the case for accelerating the vaccination program and so on. So he led from the front, and when the Prime Minister comes forward with a particular public good to be embraced by people, it made all the difference. Taking cue, taking guidance from his directions, efforts and systematic steps were taken by the union government, by the state governments, by the NGOs, by the private sector, by the Panchayati Raj institutions, self-help groups. The media played a lot of positive role. We must give huge credit. All India Radio made an important role. Doordarshan played a very important role. So it became the national orchestration, and truly, as you say, it was a Jan Abhiyan or people's movement.
And Doctor, most of our listeners would want to know that are there any new vaccines in the pipeline? Are we looking at something which is probably more effective or something?
I'm very happy to state that India has the capability for practically all the platforms for COVID-19 vaccine. We have used 2 vaccines which matured early, and then large quantities were available. But we also had a DNA vaccine which is proven to be useful. We have a protein subunit vaccine called Corbevax, which is by the DCGI already licensed for use. We have mRNA vaccine, which is again licensed, which is a unique vaccine, which is other mRNA vaccines require -80 to be stored and to be transported. This one is on normal cold chain conditions, which means simple fridge. It can be stored and carried. So it's a great invention. The world is surprised that such a technology could be developed. They recognize it with great appreciation as well. And eventually perhaps it will also be intradermal. This vaccine may be not only be intramuscular. And it's a platform which is very useful for future. So we have that. And we also have, coming into future, an intranasal vaccine, which will just be sprayed to be put into the nose, and that could come. Now all these other platforms will come handy as we move forward. Pandemic is still going on. We do not know which way all these technologies may be useful. Let's hope all this will not be needed.
And now one final question I have, that we've crossed the 200 crore mark. What is the way ahead now?
Well, precautionary dose is required for someone who has received the first course of 2 doses and has now, since the second dose, 26 weeks have elapsed or 6 months have elapsed. Then you're due for a precaution dose. And you need this because by this time, we believe your immunity may be weak, and you need to boost it. And this is a precaution that you wish to take should the virus continue to bother you. So it is ensuring that you as an individual, I as an individual, my family, my nation, we are all protected through an optimum schedule that ensures optimum immunological protection. So that is the need. A need is not, a luxury. It's not a choice that you have to make. It is needed. Therefore, all of us, now all adults, are from 15th July to 30th of July are eligible to receive free precautionary dose in government centers, provided you fulfill this condition of having got 6 months since the second dose. About 5.5 crore people have already received. The precaution dose was already free for 60 and above, but now it is free for every adult. So A, you need it if you have elapsed 6 months since the second dose. B, don't delay it if you are not fully protected. And that is why the government has now taken a decision under the leadership of the Honorable Prime Minister that we will have a special mission over 75 days from 15th July to 30th of September to focus on precaution dose to ensure that in mission mode we increase the coverage of the precaution dose among our citizens optimally. This is a continuing agenda. This is our mission for COVID-19 vaccination is not complete till we do it, and therefore I would request and appeal that please take your precaution dose now that it is even more freely available through the government system. Earlier it was available only through the private system on payment, except for those who are above 60. So now it's available. It's a text store, thousands of vaccination centers in the government sector. So the reach has also increased. And I would also appeal that kindly promote this in your own way. Those who are listening, you all play a role, in different role in terms of letting people know, let your family know, let your relatives know, let your co-workers know, and help organize special efforts that the state and the union governments will do, for example, in railway stations, in bus stands, in schools, and so on and so forth, and in village heart, and so on. So be part of this important mission which is so important, which is so critical, and it's being called COVID-19 Vaccine Amrit Mahotsav of 75 days. We must complete the task of ensuring that we receive precaution dose during this time.
On that positive note, thank you so much, Dr. Paul, for joining us for this special program on All India Radio and sharing your valuable inputs with us.
Thank you.
You were listening to an exclusive interview with Dr. V.K. Paul, Chairman of National Task Force on COVID-19 Management, on the milestone of 2 billion doses of COVID-19 vaccinations. Interviewer was Anita Anand, AIR Correspondent. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our YouTube channel, News on AIR Official.